Whatever we have touched, whatever Apollo has touched over the last 3 decades is something which the country wanted to do. And I am thankful for Pranay for having beautifully brought in the personal life of mine and how we grew up and how everybody else joined us in this journey of taking Indian healthcare. I come from a small village, probably you saw there. Even today, I ask of the politicians, please give water to Nalgonda. That's the type of the village I come from. I thank my parents for giving me the luxury of studies, making me a doctor and allowing me to go to UK, US and so on and so forth. But then, I paid back to them. When I was having this wonderful life in US with my wife and children, suddenly a letter came, as you saw in that saying, there are 2 people who like what you are writing, the number of publications, so on and so forth, what you would like to do your parents. But then, if more people in our place can enjoy what you do, how will that be? He didn't say come back. I'm glad. I came back, I don't know if I was glad because everybody around me when I came, you made the most foolish mistake, go back. But I'm happy I stayed back, and that I think is my second story of life. When I came back to India, started a practice in HM. I have some friends here who had been there at HM Hospital when we started. And I started a pure cardiology practice to see what can we do, the best possible thing with available thing as a cardiologist. But there are always, for a doctor, there is an end to what he can do when he needs help of his fellow teammates. In this instance, it's the cardiac thoracic surgery. I didn't have that time Girinath or Dikshit available for me. So I used to send my patients because there was no acceptable cardiac surgery program to my beloved friend and my guru, Dr. Denton Cooley in Houston. In 1979, I lost a young man and saw his 31-year-old wife and 2 children, 4-year-old daughter, 2-year-old son, absolutely stunned. You know why that he died? Because he couldn't raise $50,000 to go for surgery to Houston. I said, how many more are going to die? And why should they? If Indian doctors, Indian scientists, engineers are par excellence overseas, why can't we bring that back here? There are only 2 people who get good healthcare in our country, that is the powerful and the rich. The powerful guy will get a free ticket to Air India and is paid for in US. He said, I understand what you are saying. How can you do this? I said, there are a number of people who are willing to come back given the infrastructure. And I think that's where it all began. Thanks to her. Many things. It was not easy. The number of obstacles that we had. In one word, I always say, if Apollo Chennai had million bricks, we had million problems. But we got over it. Because everybody saw at the end of it that there is a purpose, and this purpose, if it's done, will change history. The Chennai hospital came. But I'm thankful for the entire healthcare, as my colleague spoke here. If it all happened in the country today, thousands of hospitals, several hundred thousands of clinics, if they are all there here and they make a significant impact on private healthcare in the country, it is one man who was again the late Prime Minister and Finance Minister of India. When I wrote to him, I wish I had done a beedi factory or a beer factory instead of a healthcare. If health has to come along with your vision for 21st century, we need 1, 2, 3. The first one was that hospital should be funded like any other trade or industry. The rest is history. In less than 3 weeks, the amendment came in, and today the investors, the banks, all have helped the growth of healthcare in our country. We owe it a lot to him. But then I cannot forget the second line of people whom we have, some wonderful people who are in the public service, who have made this big difference. whenever they saw that there is a great obstacle for a private hospital, they heard me and then brought this, whatever changes that's for them. For all of them, I am very, very thankful. But more importantly, I am thankful to certainly my 4 daughters, before that my wife, who's tolerated all of these. And my 4 daughters, to begin with, started implicitly saying, here is something interesting, let's try to do it. But then I think as we moved in, they found that health is not just interesting, but I think it is intriguing to see how we can make a significant difference in health and make whatever in healthcare today is. We can very proudly say that no Indian need to go abroad, and there are more than hundreds of countries, patients who are coming to our country. This, I think, I owe a lot to the team Apollo. And it is they who continuously took it on them and saying, if you have done well, there is something like better. There is something like, if you have done wonderfully well, how can we do it extraordinarily well? This is a continuing process, and I am thankful for all of them. And this story of Apollo will continue along. The number of people who are already with us, several thousands of people who are going to join this journey of good health for our people. I can go on saying, the great many things that they have done. They have took Apollo in heart. We are already done one of the largest numbers in the world. What I am most happy is our outcomes are better than the best centers in the world, and we achieved that purpose of saying we don't have to pay $50,000 or $100,000 for a surgery. It's a fraction of the cost with better outcomes. This is what an Indian doctor, Indian healthcare system is today proud, that we have brought this discipline in health delivery in our country. For that, I think it's not just Apollo, that like Nagesh Reddy said, all of them have participated in making that difference and continuously saying, what more can we do? This is a very real phenomenon that has occurred in the country, which makes us doctors feel proud, which makes Indians feel proud, because whenever you travel, you see, a large number of people who have come to India for this care, and just totally reversing what used to happen 3 decades ago. That makes me feel very happy. But I think I am thankful to Princess Elisa to having brought Dr. Shaw. Dr. Shaw, your final word was excellent, saying this is what really we are looking for. India is facing a huge problem, like the rest of the world, with the NCDs. We are diabetic capital of the world, heart capital of the world, cancer capital of the world, and the infections are a big problem for us. Unless we do something about it, and the way we would like to address this issue is to address this issue by taking it to people. What we believe is the transformation that we would like to do is to take healthcare from the hospital to the clinic to the individual and seamlessly connect with him.